Did you know 1 in every 4 women get an abortion in their lifetime? Hi, I'm Samaya Hudgens, a pre-nursing major at Norfolk State University, and today we're going to be taking a break from the political side of abortion and talk about the medical procedure. I want to destigmatize what an abortion is and give you nothing but facts on the procedure. I'm going to use real life examples and explain to you how abortions are done. I have done extensive research of many doctors that have completed thousands of abortions to many women, old and young. Before getting to the medical talk of abortion, I want to destigmatize a few of the common misperceptions of abortions. Most women believe after having an abortion, they will not be able to carry a normal pregnancies to full term. I'm here to debunk those theories and let you know that abortion does not cause infertility in women, and there is no science behind infertility after abortion. Another theory in the media that the baby feels pain while the abortion goes on. I'd like to inform you that the fetus will not feel pain before the 24th week of pregnancy. I chose to talk to you today about abortion because there are many lies and questions surrounding it. It is so hard to talk about the medical side of abortion without negative thoughts. I'd like to take the politics out of abortion and bring the medical facts of abortion to help women make informed decisions on their health care. Did you know that abortion procedures vary depending on how far along the patient is in pregnancies? The pill abortion, also referred to as the medical abortion, can be prescribed all the way up to 10 weeks of pregnancy, about 2.5 months. Most women this early in pregnancy opt for this pill abortion. Although the pill abortion is longer than surgical abortion, it can be completed at home. On the first day of medical abortion, you can take the pill mifepristone, which will not cause any sickness, but a precaution, a doctor will prescribe an anti-nausea medication. On day two, the patient will be not taking any medication until the following day. On day 3, the patient will insert 3 tablets of misoprostol vaginally to allow them to dissolve. After about 4 hours, the patient should take 2 more pills of misoprostol and let them dissolve under their tongue. For the next few days, the patient will find heavy bleeding and cramping, and it will lighten over the next few weeks. Included in the treatment plan is a terminated pregnancy test that you will take 3 weeks after taking the medication. The next abortion I'll be talking to you today about is the vacuum aspiration abortion. There are 2 types of surgical abortions that include vacuum aspiration. The first type is manual aspiration, which requires a manual vacuum device called an IPAS. The second type of vacuum aspiration is called electrical vacuum aspiration, which is also called an EVA machine. This procedure can be completed up to 15 weeks of pregnancy, about 3.5 months. Most medical facilities put the patient under anesthesia before the beginning of either one of those procedures. Majority of the women will receive heavy bleeding and cramping. Symptoms will usually subside after the next few days of the procedure. There is more than one type of abortion that we'll talk about today, and this is another procedure that will be considered a surgical abortion. This abortion usually happens after the 15th week of pregnancy. This happens after the patient cannot get a vacuum aspirated abortions. The hospital will introduce misoprostol tablet that the patient will take orally. This medication will block the pregnancy hormone and stop the fetus from receiving vital nutrients and oxygen. Although this medication does not kill the fetus, it will smooth things along. The next part of this procedure is the patient will be injected with ditoxins into the fetus's heart. The large dose of ditoxin the fetus will usually die after 24 hours of the digoxin was injected. It will usually send the fetus into cardiac arrest. The next part of the abortion will be the patient will be getting 2 tablets of misoprostol, causing her to go into labor. After the patient delivers the fetus, the abortion will be deemed as complete. In conclusion, there are many ways to get an abortion, and these are all completely different depending on the stage of pregnancy. Abortion is healthcare and needs to be taught as such. I'm Samaya Hudgens. Thank you for your time.